Hi, Dr. Quinn.
Hey, it's great to be here.
Yeah, tell us some of the
Well,
differences
listen,
here.
right. Well, listen, the bottom line is the World Health Organization, they sort of backstated a couple of things they stated last week, and they were describing a scenario where an individual was asymptomatic, meaning the individual had the COVID-19 infection, but they didn't have any symptoms. Now, initially, the World Health Organization representative stated that these individuals have a very rare chance of spreading COVID-19 to others. But the deal is, a lot of the scientific community all over the world questioned this statement, and they made a new statement stating now that the information that they released was based on very limited research, and now they're saying that if you're asymptomatic, you can still spread the virus according to the new discovered research that they've now evaluated. So the take home is we don't need to let our guards down. We need to be very cautious, because if someone does not have symptoms, they can still possibly be a carrier. And that makes it so that we need to wear those masks and practice social distancing as much as possible.
Well, this asymptomatic spreading is why we've been to the house since the middle of March, isn't it, Dr. Quinn?
That is correct. I mean, that statement really raised a lot of eyebrows in the scientific community. And as I said, the World Health Organization did come out with a new statement. Now, they did note that the statement was unofficial. They just said that the statement was based on limited research from a few limited studies. But the take home is we need to stay aware that we need to still wear our mask. And now the World Health Organization also released a statement about 3 days ago stating that they've changed their policies in regards to masks. Initially, they weren't really advocating for masks to be used in public places unless necessary, but now they're advising everyone to wear masks in public places. They are recognizing that they want to limit medical masks to try to preserve them for medical personnel, and advising if you do wear a mask, you can wear a cloth-based mask, but they're advising to use 3 layers of cloth if you make these masks in your homes.
Okay. Yeah, good advice as always. I mean, we keep our mask on here at work when obviously we're not on the air here. And just reiterate one more time the importance of keeping your mask on to prevent the spread here, Dr. Quinn.
Most definitely. I mean, it's noted that the spread of this COVID-19 is through respiratory droplets. And these can be spread through sneezing, coughing, or even just general conversation and talking. So by wearing these masks, these cloth-based barriers, you limit the respiratory droplets that come from your respiratory system out into in the atmosphere, which could potentially expose someone to COVID-19, but it also adds some protection for you wearing the mask. So not only are you protected, but you're protecting other people from yourself in the event that you are someone that has COVID-19, has no symptoms, so you've not been tested, you don't know, and you could be infecting others, especially those that are more vulnerable, such as elderly and immunocompromised individuals. So let's wear these masks, but still, also, lastly, the World Health Organization doesn't want you to get a false sense of security. Still do social distancing, wash your hands as much as possible, and wear the mask. All these together can really help to provide safety that we need during this very crucial time.
Well, thank you so much, Dr. Quinn, as always. And we're socially distant here, Walt.
Can't even
Ken's way over there as well. So we're doing the best we can here as well and still bringing you the news. Thanks again, Dr. Quinn.